Hello and welcome. Today we're diving into a specific and often debilitating condition affecting vision, multiple sclerosis-associated optic neuritis. We'll explore what it is, why it happens, and what can be done about it. Understanding this connection is crucial for early detection and effective management. So, what causes this optic neuritis when it's associated with multiple sclerosis? The underlying culprit is MS. The body's immune system mistakenly attacks myelin, the protective sheath surrounding nerve fibers in the brain's spinal cord, and crucially, the optic nerve. This inflammatory attack on the optic nerve's myelin is what leads to optic neuritis. Now, let's break down how this attack affects your vision. The inflammation caused by the immune system disrupts the nerve signals traveling from the eye to the brain. Myelin's job is to speed up these signals, so when it's damaged, the signals become weak or distorted. This disruption results in various visual disturbances, from blurred vision to complete loss of sight in the affected eye. Multiple sclerosis-associated optic neuritis is most common in adults, typically between the ages of 20 and 40, mirroring the typical onset of MS. It's important to note that optic neuritis can be the first symptom of MS in some individuals, highlighting the need for careful monitoring and diagnosis. While exact numbers fluctuate, a significant portion of individuals diagnosed with MS will experience optic neuritis at some point during their illness. Studies suggest that women are more likely to develop MS and, consequently, MS-related optic neuritis than men. The signs and symptoms of MS-associated optic neuritis can vary from person to person, but some common indicators include eye pain, often worsened by eye movement, reduced visual acuity, meaning blurring or dimming of vision, color vision deficits, particularly difficulty distinguishing red colors, visual field defects, such as blind spots or a loss of peripheral vision, and sensitivity to heat, known as Autoimmune phenomenon, where vision temporarily worsens with increased body temperature. Diagnosing MS-associated optic neuritis involves a comprehensive evaluation. A doctor will perform a thorough eye exam, including visual acuity tests, color vision testing, and visual field assessment. An ophthalmoscope is used to examine the optic disc at the back of the eye, where swelling or pallor may be observed. MRI of the brain and optic nerves is crucial to look for evidence of demyelination, both in the optic nerve and elsewhere in the brain, which can support a diagnosis of MS. Visual evoked potentials, or VEP, measures the time it takes for electrical signals from the eye to reach the brain and can detect optic nerve damage. While there aren't distinct types of MS-associated optic neuritis as far as subtypes of the optic neuritis itself, it's important to distinguish it from other causes of optic neuritis not linked to MS. The key differentiator is the presence or absence of other demyelinating lesions in the brain, which strongly suggests MS as the underlying cause. The primary goal of treatment is to reduce inflammation and speed recovery. High-dose intravenous corticosteroids are often the first line of treatment to reduce the inflammation of the optic nerve. While steroids can accelerate visual recovery, they may not have a significant long-term impact on visual outcome, depending on the severity and frequency of optic neuritis episodes and the overall progression of MS. Disease-modifying therapies (DMTs) for MS are crucial to slow down the underlying autoimmune attack and prevent future episodes. Pain management for eye pain is also an important aspect of care. Currently, there's no definitive way to prevent the initial onset of MS or consequently MS-associated optic neuritis. However, adopting a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can support overall health and potentially influence the core MS. Early diagnosis and prompt treatment of MS with disease-modifying therapies is the best approach to minimize the risk and severity of future optic neuritis episodes. The prognosis for visual recovery after an episode of MS-associated optic neuritis is generally good, with many individuals experiencing significant improvement in vision within several months. However, some individuals may experience residual visual deficits. The risk of recurrent optic neuritis and the overall long-term visual outcome are closely linked to the course and management of the underlying MS. Recent research is focused on developing more targeted therapies to protect the optic nerve from damage and promote myelin repair. Furthermore, research on biomarkers is ongoing to identify individuals at higher risk of developing MS after an initial episode of optic neuritis, enabling earlier intervention.